let us have an interactive session. So before getting into the actual syllabus and actual, yes, audio only, please. Okay. So before starting off, let us first understand what we are attempting for. We are attempting for the pharmacist exam. So any one of you can you briefly tell me what your qualification is and what do you think a pharmacist is? So just briefly, let us understand who governs the pharmacy students, the pharmaceutical works and everything in Tamil Nadu. So it is governed by the Tamil Nadu Pharmacy Council, and we are centrally governed by the Pharmacy Council of India. So we don't know what the blueprint is. We don't know how we will have questions. So I thought let us just cover from the scratch itself. So what is Tamil Nadu Pharmacy Council? So basically what the Pharmacy Council does is, the initial work of them is to provide the registrations and licenses for all the pharma holders. Additional to this, they are also into some form of research. They are also collaborated with CDSCO, the Central Drug Society, which is in Faridabad. We can expect questions such as who is constituted of the Tamil Nadu Pharmacy Council. So just we'll just hear about that. So there are 6 members who are elected. They are registered pharmacists and they are themselves elected. Then we have 5 members who are nominated by the government of Tamil Nadu. We have 1 member from the Tamil Nadu Medical Council, and we have 3 ex officio members. So we have a total of 6, 12, 15 members as a team. And it was constituted in 1954. It is okay if you don't remember the date, but please, 1954 we can remember, I think. So let us get the date. So very briefly, let us see what are the duties of a pharmacist. So duty is basically to evaluate, interpret, and implement medical orders. That is nothing but seeing the prescriptions or whatever drug orders which is being given by the medical hospital or any license. Primarily the work in India, whilst a duty of a pharmacist also involves in drug and device selection, drug administration, and reviewing the drugs for patients who are posted in wards, and for drug related research. So this particular point is booming, and that is why we have courses like Doctor of Pharmacy, and we have M.Pharm pharmacy practice also. Next is provide patient counseling. The term may be very fancy, but this is something that we all do. When a patient comes, we tell them how much to take. So that's basically patient counseling. You give an extra information about what kind of food to take, what to take with it, what not to take with it. That becomes a complete counseling. So is this clear for everyone? You're able to follow me, right? Okay, so from now on, let us go into a few practice questions. Let's do 20 questions now, and then you people give me the feedback, and then we can go forward, right? Question 1. Crystal urea is the side effect associated with. So how many of you know what crystal urea is? Raising hands will help. We can take it quickly. Yes? Okay. Can somebody type out what crystal urea is in the chat box? Uric acid. Okay. Anything else? Gout. Okay. Okay. Uric acid deposits. Fine. Anything else? Okay. So crystal urea. Split the term. Crystal urea. So it can be uric acid, but not primarily uric acid. It is the end form. So crystal urea is basically you see some form of crystals which is deposited in urinary bladder. Sometimes it may present in urine. Sometimes it may not be present. Yeah, right. Urea present in the form of crystal can be right, but crystals can be in other forms also. So we will read about it. Let me give the options. Option A, quinolone. B, azoles, sulfonamides, and taxol. Okay, so can you guess the answer? Let's just take 30 seconds. 2-3 more people. Okay, so everybody is clear. It is, yes, it is right. C is the right answer, sulfonamides. But why do you think it is sulfonamides? What is sulfonamide? Antibiotics. Antibiotics, not all the antibiotics. Antibacterial, very good. Yes, antibacterial. Any other answer? What about quinolones? No. What about azoles?
Azoles, it's fungal infections.
Okay, fungal infections, right? Quinolones is?
Quinolones is anti-malarial.
Anti-malarial, right. Okay, so taxols? Taxols are usually not particularly used in therapy. So what happens? Cancer therapy, but not preferably used much. Only some forms of taxols are used. So what happens in sulfonamides is it is an antibacterial, and another thing which you have to keep in mind is any sulfa related drug. For example, in diabetes, if there is any sulfonylurea drug, so that can also cause crystalluria. They may ask you the question as which drug causes urinary tract infections in anti-diabetics. So that can be any sulfa drugs which can cause crystalluria. So now let us just go one step ahead. How do you prevent crystalluria, or how do you treat, or at least how do you control this one, crystalluria? Something home method? Okay, I'll just tell you so we can quickly move on. Enough hydration itself can cure crystalluria, right? Bhumirajan, you're right. Plenty of water is right, but we can use a term for it. So it is inadequate hydration. So if you've been asked a question, how do you treat crystalluria? Then you can say adequate hydration, right? Okay. Let's move on to the next question. The Drug and Cosmetic Act was passed in, anyone without options, can you tell?
1950.
1940? 1948. Okay. We have the options now.
1940, April 10th.
Yes, 1940, April 10. 1980, it was again, there was a revision which happened in 1948. So we take it as 1940. Okay. Okay, so next question. Which of the following is a female sex hormone? Sylvestrol, estrogen, testosterone, benzestrol.
Estrogen.
Estrogen, okay. Estrogen. Okay. Okay, so what is sylvestrol?
Synthetic female.
Okay, very good. Testosterone?
Male.
Male, is it not present in females?
Yeah, it's minimum.
Yes, it is minimally present in female. Okay. What is benzestrol?
It's also synthetic female.
Okay, so we have two synthetic female sex hormones, which is sylvestrol and benzestrol. Okay, so you guys are clear with that. Next question. So answer is estrogen. We'll go to the next question. Chloroquine is a acridin.
Anti-malarial.
Quinoline, biguanide, pyrimidine. For quinoline, okay. What about biguanide?
Biguanide is anti-diabetic. Metformin.
Anti-diabetic, okay. Correct?
Metformin.
Okay, but this question is based on structure. So we'll have to answer specifically on structure.
4
Quino,
Quinolone properties.
sorry? 4-aminoquinoline has a quinoline ring. It contains nitrogen in it, which is why I asked biguanide, because again biguanide also contains a nitrogen group there. So you can just look up to what the structure of chloroquine is like. I'll at the end I'll give you a few drugs with its structure so you can have a look at it. Okay, so the answer is 4-aminoquinoline. Okay, so we'll go to the next question. In the pediatric dose calculation in the first 20 days of birth comes under the class of answers. Anybody?
Neonatal.
Neonates.
Okay. Anybody else? Neonates. Okay. Infant, child, neonate, just born. Okay. Neonate is the right answer. So can you tell me what is the age group for child?
12 months to 1 year. For child, above 1 year.
Above 1 year, up to what?
12 years.
Up to 12 years or 18 years?
12 years.
12 years, okay. 12 to 18, what do we consider?
Sorry.
Sorry?
12 to 18 for adult.
It is adolescent, so we use. I'll tell you about it now. Okay, how about just born? What is the age range?
2 weeks.
2 weeks, is it?
Yes.
Okay. How about neonates then? Then we have a confusion, no?
Yes.
Neonate and just born is the same then?
1 to 7 days just born.
7 days. Okay, fine.
7 to
Okay.
neonates.
Okay, actually just born and neonates are very, very similar. When in terms when we have neonate and just born in a scenario, then we consider it as neonate only. Just born will be just few hours after birth. So you can use it vice versa. Okay. So what is the age range for upper age limit for neonates? Anybody?
22 days.
24 months.
20, no months, only days.
Only days.
22 days. 28 days.
28 days is right. So neonate, the age range is within 28 days. Just born also can be 28 days or it can be few hours after birth. Child is 1 to 12. Okay, so infant?
2 weeks.
No, just
1 to 3. Just 1 year. 1 year.
No, 1 year meaning what do you mean? Age range, give me a range. How many
2 years.
days?
Up to
1
2
year.
years.
Okay,
Up
no.
to 2 years.
No, I think the previous person, she meant 0 to 1, 29th day to 1 year is an infant. Because until 28 days, we call them neonate. So from the 29th day to 1 year, we call them the infant. Then from 1 year to 12 months is the child. Okay, so the answer is neonate. Can we move forward? Okay, with this, let me also go for, okay, so what are the pediatric dose calculations that we are aware of? Any name that you're aware?
Yes, the Meng's rule.
Okay.
Clark's rule.
Clark's rule, correct. Delling. Okay, right. Price rule, yeah, very good, right. So I'll just give you the rules formula. If you have a pen and paper, you can just make a note of it. So I'll tell you how the question comes. So Young's rule is age in years divided by age plus 12 into adult dose. Dilling's rule is age in years divided by 20 into adult dose. Hyde's rule, age in months divided by 150 into adult dose. So these three are basically for age, related to age. There are other rules also, but these are very, very popularly used, and questions also keep coming on these rules. So it is more like they will provide you the formula and then ask you what rule it is, or they may provide you the name of the formula and give you the answer. So you may have to pick the right one. So the next rule we have is Clark's, which is based on weight. So weight divided by 70 into adult dose. So this is about pediatric dose calculation. Later, let us deal in detail about this also. And right now, let us just go through as and when the question comes. Okay, so we'll go to the next question, or do you want time to write it down?
Please wait, ma'am. Kindly write down.
Sure. Okay, can we move forward?
Yes.
Okay, so next question.
Okay, ma'am.
A naturally occurring carminative is. So, what is a carminative? Any idea?
Carminative is NP3 gas.
Correct. Okay.
That's
Anything else? Any other term that we can use for what you told? Expel from gas. Ajit, you're right. But any other technical term? Okay, we are only learning about the terms, so you may be able to answer if at all asked in such a way also. Okay, so let me give the a naturally occurring carminative. Carminative can also be called a form of a drug. Antacid is a drug. I want the technical term. Carminative is to relieve flatulence. Expel gas, you said, is right, but the technical term to it is flatulence. 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 Okay. So let us see the options. Ashoka, Sufetida, Arjuna, Agar. Answers, please.
Asafoetida.
Okay. Everybody is okay with Asafoetida?
Yes.
Right. Okay. So what? Let us also see what does Ashoka do. Ashoka is a bark. So what does it do? This is a pharmacognosy question, so that's why we'll just briefly know what it does. Okay. So Ashoka bark is used to treat hypertension. It is known to treat hypertension blood pressure along with other drugs. Arjuna is also used to treat hypertension. It is used in cosmetic items, especially for face whitening. It is very, very helpful in hair growth. Arjuna and Ashoka. Agar, what is agar? Sorry? Agar can be a gel which can be used for either as a sweetener in very, very limited agents, or in some suspensions for uniform solubility. Okay, so let's go. So the answer is Asafoetida. Next question. The meaning of Latin term Rx. Sorry?
You take.
Okay, you take. Okay. Anything else? Yes. Take thou is the right answer. Superscription, yes, right, but it does not imply the meaning. So let us be a little more particular. Take thou, when necessary, send, write. Okay, so now what do you think Rx is? Apart from take thou, what is
Send.
it?
Sent.
Name.
Recipe. Okay. It can be recipe. One more thing. Anything else?
Include.
Feeling of God.
Okay. So in Greek, the physicians there thought RX as a symbol of Jupiter, right? God of heal. Ajit, you're right, God of heal. So it is basically before writing, like before how we pray, before doing a particular thing, the physicians there pray to the God of Jupiter, saying the person should heal. So that's what the symbol RX is. Okay? The answer is take down. Let's move to the next one. A drug price control order was exercised by central government in 1985, 1995, 1987, 1997. Answers, please. Okay, so
1980.
what is, yeah, correct. What is drug price control order, first of all? Any idea? Why was it started?
This drug. The MRP should not increase this drug. Same actually like common price only.
Correct. Okay, common price, right? But any background for it? Okay, so basically, after the 1990s, there were a lot of manufacturers, especially related to pharmaceutics. Pharmaceutical manufacturers were plenty in numbers, and because of the cost, some were high, some were low. There were also issues in receiving drugs to hospitals. So there was no balance. One particular hospital would get a lot, one particular hospital would get a very low quantity of drugs. So this was all attributed to the price of the drug. So then the government formulated it in the year 1995. Fixed price. But do we follow fixed price now?
No, no.
No, no.
No more. Okay. But it is just there. There are revisions which is happening on the price control order, but we don't technically follow it. Okay, but this question is also repeated in many other question papers. So we have this question here. Okay, we'll move to the next question. Myocardium is a special muscle tissue found only in the answer. Everybody will do this. Heart.
Or
Correct. Okay. The options are brain, stomach, heart, lungs.
heart.
Heart. Okay. So tell me, what is the covering of brain called then?
Meningitis.
Meningitis is the wrong answer. Meningitis is a disease. Be little more specific. You are right with the word, but you got into the disease.
Meningitis.
Meninges is the right one. So just we'll be little careful, okay? Meningitis, any word which ends with itis, itis is called an inflammation. So that is attributed to a disease. Okay, so meninges. Okay, what about stomach? Okay, so stomach is covered by a lining called mucosa. Okay, yeah. What about lungs? Pleura, correct. So what is beneath pleura? Just below pleura? We have the pleural fluid. So what is inflammation of pleura called?
Bronchitis.
Very similar to what she just told. Meningitis she mentioned. So what is it for pleura?
Bronchitis.
Pleuritis.
Pleuritis.
Exactly. So bronchitis is not in the pleural region. So we don't consider it that way. So pleura, it is pleuritis. Okay. So these are, this is something very basic. So the answer is heart. We'll move on to the next question. The schedule to which list of drugs to be sold on prescription only.
Schedule H.
Schedule?
H.
Schedule.
H. Okay.
It's also narcotic and psychotropic also.
Okay,
And
fine.
also.
Yes.
Schedule C also.
Schedule C. Oh, okay. I'll give you the options. Schedule L, Schedule X, Schedule M, Schedule W.
Schedule X.
Schedule
X.
Schedule X. Okay. What about Schedule L? Some of you told Schedule L also. Okay, so in such kind of questions, how do we answer?
L is omic.
Exactly. That is why I specifically put it there. So we may tend to get confused when we have two right answers. Schedule L is also right, but Schedule L is being pushed to Schedule H. Okay. So the answer is Schedule X. So this is just a list of few schedules that we have. In this important ones, I'll send you this so you can go through. But very important ones are Schedule G, that is list of drugs that can be taken only under supervision of medical practitioner. Okay, that is one. Schedule H is again very important, but it implies the same as the question. It should be sold only on prescription. It is not clear, is it? Okay, I think when I send you, it will be fine. I'll just read two more schedules for you, and then we'll go to the next question. Schedule M, it is for good manufacturing practices. And we have Schedule P, which prescribes life period of drugs. So these are some repeated ones which are being asked. So I'll send you this one later. Okay, so next question. Mannitol is, what is mannitol?
Osmotic diuretic.
Okay, anything else apart from osmotic diuretic? Isn't it also a sweetener?
A sweetener in chewable tablets.
Yes, okay, so it can also be a sweetener. Options are loop diuretic, osmotic diuretic, potassium sparing diuretic, and carbonic anhydrase diuretic.
Come on.
Yes, everybody?
Osmotic diuretics.
Okay.
Awesome.
Any other answer? Okay, so what is an osmotic diuretic? Just tell me what it inhibits. We should only remember three things. One is water, one is sodium, then potassium chloride. So with these four things, if you're able to answer it, it will be good.
It acts on ascending loop of Henle.
Correct. Okay, but what does it do?
Sodium
Exit osmotic pressure.
Okay, no, just answer in terms of water, sodium,
Excretion
potassium.
of urine, excessive sodium, potassium in urine. So
It will decrease the potassium level.
Okay. Okay, basically it will just reabsorb, it will inhibit the reabsorption of water and sodium. Osmotic diuretic will inhibit reabsorption of water and sodium. Okay. What does loop diuretic do? In that way, can you answer?
furosemide,
Furosemide, correct. Very good. What is the
tarsemide,
option? Loop diuretic, as the name suggests, it acts on the loop of Henle. So it will act on the sodium potassium chloride co-transporter.
2-chloride to co-transporter.
Okay, so it will act on that to inhibit it. Next, potassium sparing diuretic.
Act on distal convoluting tubules.
Yes, correct.
Sodium chloride symport.
Exactly. Sodium chloride symport will happen, but what is it that it will do mainly? It will retain all the
Potassium.
Yes. So who is it given to? Usually what happens in diuretics is when a diuretic is given, you see sodium and potassium going high or low. Okay. So in patients who have hypokalemia, which is very common in kidney related disorders, they give potassium sparing diuretic. So the potassium is retained. It is not excreted out. So what happens when hypokalemia occurs? Any symptoms that you are aware of?
Swelling of feet.
Continuous urination.
Swelling of what?
Feet.
Swelling of foot.
Foot. Okay, that must be sodium. That is also increase in sodium. So potassium is actually, it is life threatening. It causes excessive energy loss, and it may also affect your brain. So even if it goes below 2.5, it is very, very necessary for you to get admitted and get replenished with potassium. It is a very deadly thing. We always think sodium should be kept under control, but potassium also equally plays a role. To have excessive sweating, which you can see when you have low potassium. And there may be cases where frequent fainting happens, which needs to be addressed. Okay, so next one is carbonic anhydrase diuretic.
Sidazolomate.
Yes. Okay, where does it act?
Proximal convoluting tubules.
Okay, very good. What does it do? What does it reabsorb?
Sodium potassium symphyl.
No, reabsorption.
Reabsorption of sodium.
Yes, sodium along with all the diuretics reabsorb sodium, but along with it, what else do we have? Just go by the name carbonic. So what does it reabsorb?
Carbonic acid.
Carbonic acid, or is acid present in our system?
Hydrogen.
Bicarbonate. Okay, not carbonic acid. And then we have, so it works on reabsorbing three electrolytes: sodium, bicarbonate, and chloride. Okay, so mannitol is an osmotic diuretic. So we'll also learn, I'll just give 2-3 examples of each so that we can, we'll make a tabular column. We'll give examples, and then it will be easy for you to answer other diuretics also if asked. Okay. Sorry? I'm sorry, I'm not aware of your names. I think going by, I'll get to learn your names. Okay. Okay, so this is just a description. So loop diuretics we have, which acts on loop of Henle. We have thiazide diuretics, which acts on distal convoluted tubule. And we have potassium sparing diuretics, which acts on the distal convoluted or on the collecting duct also. Okay, let us move forward. The formulation used for dental hygiene are known as
dentifrices.
Okay, anything else? Options are insufflation, snuffs, cachets, and dentifrices. Dentifrices is the right answer. But what is insufflation?
Insufflation means cleaning of body cavities.
Yes, nose cavities. Snuffs?
Used in nose.
Exactly. Snuff insufflation or for your nasal cavity, or it can be to deliver drugs through your nose to your lungs. So what are cachets?
Cachets are made up of two. One pill is put in one.
One pill is? Yes. Are cachets in use now?
No. We can use capsules.
Capsules they use. Okay, so it is basically more like giving drugs to children. So you take if you have to give a tablet to a child, you take the tablet, you sometimes put it inside a chocolate or any jellies. So that is what they did with cachets. Indian way of cachette formation was by coating rice flour around a drug, but
Right.
it was later discontinued. Okay, so the answer is dentrifices. So dentrifices, we can have dental powders,
Paste.
then pastes. Yes,
Tooth
pastes.
powder.
Yes, tooth powders. All this can be dentrifices. Okay, let's go to the next question. You're clear with this, no? Everybody, you can raise your hands.
Yes, ma'am.
Yes.
Yes.
Okay. Fine. So, you have anything particular that you want to know? You can just put it in the chat box. I hope this is helping you.
Snap means ma'am. Snap.
Okay, so we'll move to the next question. Erythroblastosis fetalis arises due to incompatibility in.
Blank.
Okay, anything else? We have options as lymph, synovial fluid, blood, and bile.
Blood.
The answer is blood. Okay, so what happens in erythroblastosis fetalis? So it is basically erythro means anything which is erythro is blood. Blastosis is blasting. So your red blood cells are being blasted. Fetus is a child in the womb. Okay, or when the mother is pregnant, then it is called fetalis. The child is called the fetus there. So what happens is when the child has a negative blood group or the mother has a negative blood group and the child has a positive blood group, it can be vice versa. One person having a negative blood group, one person having a positive blood group. In such a case, when the mother's blood group is transported via red blood cells are transported, the fetus, if it is a negative blood group, then it will think as a foreign body and starts blasting its own red blood cells. Okay, so that is called erythroblastosis fetalis. This is mostly curable. I mean, not curable. It gets fine by its own, but some conditions it does not get fine by its own. And this happens only in first pregnancy. They usually don't see this in the second pregnancy. Okay, so let's move on to the next question. So, okay, just to two things to keep in mind. If any question, something which comes with erythrocyte, that means it is blood. So the blastosis is breakage. So that's all you have to keep in mind. Next question. A parenteral anticoagulant drug is
Heparin.
Heparin.
okay. Anything else?
Dalteparin.
Yes. Dalteparin, yes. Okay, so let me
Dalteparin
give you. Yes, I'll give you the answers. We have penicillin, phenandione, we have warfarin, and we have heparin.
Heparin.
Okay, Ajit is saying warfarin. Okay. Priyadarshini says heparin.
Venice.
Heparin.
Yes, so answer is heparin. Warfarin and phenandione is available as oral formulations, not as parenteral. So we consider that. And penicillin, you all know, penicillin is an antibiotic.
Antibiotic.
Okay? It does not come into the anticoagulant category. Okay. Fine. So we'll move to the next one. Drugs and Magic Remedies Act was passed in
1954.
1954.
yes, 1954. I really don't know how to make you remember this. So these are questions that we just have to mug up. So very sorry about that. We'll move to the next question. A non-drug part added to formulation to aid dilution, stability maintaining, taste making is known as
Additives.
Okay. Anything else?
Additives.
Anything else?
Emulsifying agents.
Okay. Emulsifying agents. Then
Sweetening agent.
Diluent.
diluent. Yes.
Lubricating agents. Sweetening agents.
Sweetening agents.
So what are these collectively called?
Additives.
That's right.
Excipients.
Excipients and excipients. Yes. So we can either call it as excipients or additives. So the answer will be additive. So sweetener is also an additive. Binding agent is an additive. Active ingredient, can it be additive? Actually, yes. In some cases, it can be additive. Not in traditional form of medicine, but in certain form of tablet manufacturings or any dosage manufacturing. If they know that one particular drug can enhance the effect of other drug in very, very low quantities without causing any harm, then they also use it as an additive. Okay. So, but not generally happening. So it is called the additive. Okay, now we have one next question. This is like school level question. Everybody will tell fast. Powerhouse of the cell.
Mitochondria.
Okay, right. Yeah, see, everybody told. Nice. Golgi bodies, mitochondria, ribosomes, nucleus. So it is mitochondria. Okay, so we move to the next one. Which of the following is not a benzodiazepine? Diazepam, triazolum, zolpidem, nitrazepam.
Zolpidem.
Okay.
Zolpidem.
What about triazolum?
Triazolum is benzodiazepine.
Okay. Nitrazepam?
Has been diazepams.
Okay. So answer is zolpidem. But what is zolpidem?
Non-benzodiazepine derivative.
Okay. What does it do?
Hypnotic.
Sedative. That's it. Yeah, hypnotic and sedative. So other benzodiazepines are not as sedative. I mean, it does not give a major sedative effect when compared with zolpidem. Okay. So that is the one. Next question. Which of the following is a natural emulsifying agent obtained from vegetable source? Starch, gelatin, egg yolk, wool fat.
Wool fat.
Starch.
Wool fat, vegetable source? No.
Starch.
Yes. Okay. Starch. Okay. So I don't think any description on this is required. But if at all you have anything, you please let me know. Okay. So we'll go to the next one. A chelating agent used in case of poisoning agent or consumption of poisoning is sodium phosphate, dimercaprol, ferroin, bismuth subnitrate.
Dimercaprol.
Okay. What about bismuth subnitrate? No.
From coating in ulcer.
Exactly. Correct.
Dimercaprol is also called as British anti-leviside.
British?
Anti-leviside.
Anti-leviside. Okay, so I didn't know that. Okay, thank you. Okay, so the answer is dimercaprol. What other poisoning chelating agents we have? Very, very simple one.
EDTA.
EDTA, correct? Something else? In very, very, very mild forms of poisoning, local hospitals suggest one particular thing.
Charcoal.
Charcoal. Activated charcoal.
Activated charcoal. Can we write charcoal as the answer, or should we write activated charcoal as the answer?
Activated.
Yeah. So that is what we have to keep in mind. Activated charcoal. If asked, we can write. But if at all we had the option of charcoal also here, we usually will not prefer because it is not it's not medically practiced much. So we go for answer which is medically practiced. Dimercaprol we can widely see. Okay. So we'll go to the next question. 1 fluid ounce is
30 ml.
30 ml.
30 ml, right? Okay. So this is also mathematics, which is it's just there, so we have to just go for it. Okay. So we've just finished around 2021 questions. Is this method okay for you people, or do you want any other approach?
Okay.
No, it's okay.
This is okay, or do you want? Can we also go for few topics? Can we go for overview of few topics? Is that okay with you?
Yes.
Anything like that, or do you want only practice questions?
Just add over questions.
Overview questions, I'm not sure if we can add. I was just thinking if we can just go through the topics what is given in the syllabus and just run through the syllabus if possible, how much ever possible we can run through. That is also okay. Can we keep the class as practice questions? We'll run through quickly. Today I'm aiming for 50 questions. I don't know how much we'll be able to finish. And
In Tamil also.
I'm sorry? I can combine. It's okay, no? Okay. Oh, yeah, I can hear you now. So we can
Tamil பேசலாமா?
தமிழ்ல பேசு. Okay. இது மட்டும் உங்களுக்கு ஓகேவா? பிராக்டிஸ் क्वेश्चंस மட்டும் ஓகேவா? இல்ல ஓவர்வியூ ஆஃப் சில டாபிக்ஸும் ஓகேவா உங்களுக்கு?
எல்லாம் இந்த மெத்தடே ஓகே தான். இல்ல ஆன்சர் தமிழ்ல பண்ணனும் தானே? ஆன்சர்
தமிழ். ஓகே, ஓகே. எல்லாருக்கும் தமிழ் வருமா இந்த குரூப்ல?
Yes, ma'am.
Yes, ma'am.
Okay. I'm not very fluent. I'm like, okay, I can explain but not very fluently in Tamil. So I will do maximum possible. If at all you're not understanding, please just message. I'll see how to answer it. Okay?
மேடம் கொஞ்சம் சார்ட் மாதிரி கொடுங்க மேடம்.
சார்ட்டா? என்ன சார்ட் வேணும் மேடம்?
இப்ப இந்த இது டோசேஜ் ஃபார்ம்ஸ் இந்த இப்ப அவுன்ஸ் கொடுத்திருக்கீங்கல்ல, ஃப்ளூயிட் 1 ஃப்ளூயிட் அவுன்ஸ் அந்த மாதிரி அது ஒரு சார்ட் பண்ணி கொடுங்க.
யா sure.
அந்த ஷெட்யூல் ட்ரக்ஸ் அது ஒரு இது மாதிரி கொடுங்க சார்ட்.
யா ஓகே.
டர்ம்ஸ் ஒரு சார்ட் மாதிரி கொடுங்க.
ஓகே. நான் வந்து நிறைய கொடுக்கல. I'll not give you too much because time is very limited. அப்படின்றதுனால ரொம்ப காமனா கேட்கிற சில questions ஓட charts எல்லாம் கொடுக்கிறேன். For example, Latin terms is very commonly asked. So I'll give you a chart for it. I'll give you a chart for scheduled drugs. Fluid ounce is okay. I'll give you and they also ask about metric systems, kg, grams, all those.
Yes,
okay, so I'll give you that one also. But if you are very aware and if you are very confident that there are few parts which is very important, you can tell that also, so we can prepare according.
Okay.
ஏதாச்சும் particular topics இருக்கு அப்படினாலும் okay. Okay, so let's just move on quickly. Let's see if we can finish another 10-15 questions. Okay, the plant drug which is oxytoxic.
Got it.
She, Vinca, cocaine. Everybody is okay with this one? Ergot, okay. What is cocaine? Where is cocaine used?
Drug acting on CNS.
Opioid analgesic.
Opioid analgesic. So it is basically used as a painkillers. Okay, and it is some form of cocaines are also narcotic drugs. So we'll have to be careful when prescribing and giving it. Okay, can you give me an example of a drug which is oxytoxic but it's not plant? What is a chemical oxytoxic drug which induces labor? Something very common.
Oxytocin.
No, oxytocin is the hormone. So we want to know what can stimulate oxytoxic effect. So there is a drug called pitocin, synthetic oxytocin. Okay, it is called pitocin. It is very commonly seen in hospitals. Okay, so the answer for this one is ergot. Okay, we'll go to the next question. What are filter sheets made of cellulose called SEDS filter, membrane filter, glass filter,
Membrane
synthetic
Membrane.
Membrane.
Membrane filter.
membrane.
Membrane filter.
Okay, so why are filters basically used? In which where do we use filters?
Filters used in early session.
Separation.
Okay, but what does it do basically?
Separation.
Separation, fine. Ultimate aim?
Remove bacteria.
It's the impurity.
Yes, so basically it is to remove impurities. All this is used in microbiological lab purposes. Okay, so out of SITS, membrane and sintered glass, these are for very, very small pored objects. It can be powdered forms, it can be spores, it can be very, very small bacteria also. But usually they do not filter out microorganisms through these methods. So these are all for porous particles or for some excipients that we add which cannot be compatible with the dosage form. Okay, so membrane filter is the basic one which we also use in the lab. The other ones are all complex ones. SITS has a big setup. It is more like a pressure cooker that we have. So glass fiber is, it uses borosilicate fibers. Sintered glass, they powder glass and use it as a filter. So that is the sintered glass filter. So all this is used in microbiological laboratory purposes. Next question. Sterols belong to the class of lipids, waxes, carbohydrates, proteins.
Lipids.
Okay, what about waxes? Yes.
Paraben.
Paraben wax. Correct. Correct. Okay. So those are examples. So the answer is lipids. Next question. Hepatitis is a protozoal infection, viral infection.
Viral.
Viral infection.
Viral infection. Right. Okay. Can you give me an example for protozoal infection?
Malaria.
Malaria.
Yes.
Amoebiasis.
Amoebiasis. Very good. Okay. Viral infection apart from hepatitis.
HIV.
Smallpox.
Yes.
Corona.
Something very common.
Corona.
Smallpox.
Yes. Corona. Correct. Okay. Bacterial infection.
Typhoid.
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 Cholera.
Pneumonia.
Yes. Okay. Fungal infection.
Candidiasis.
Candidiasis. Very good. Yes. Okay. So we are aware of at least 2-3 names for an infection. That I think that should be fine. The common ones, I'll make a tabular column for you all. Agents promoting easy bowel evacuation is termed as
Laxative.
Laxative. Laxative.
okay. Everyone is fine with laxative. How about antacids?
Is I can in the stomach only.
It form a layer on stomach to prevent ulcer, something else. No?
Yes. Okay. So it is just a protective layer around your gastric region. Adsorbents, we usually, it is an additive, so we don't have to worry much about it. Protective again is an additive, so it is laxative. Okay, so what is the commonly given laxative?
Senna.
Ispicola.
Sorry?
Senna isabel.
Okay, can you tell me anything which is marketly available?
Tufalac.
Dufalac, yeah. Okay, so
Lactulose content. Lactulose.
Yes.
Lactulose, yes. Okay, but Dufalac more commonly used. Okay, fine. We will move to the next question. Creams are Emulsion,
Easily spreadable.
suspension,
Okay.
ointments,
Emulsion B.
emulsions. What about suspensions?
Emulsion.
Emulsions, okay. Why is it emulsions?
Emulsion based, man.
Yeah, but can you tell me why is it emulsion?
If
By
it
base.
mixed, we can't separate, ma'am.
Okay. Okay, so I'll tell you why I asked this question. When such kind of questions come, they expect us to answer in pharmaceutical form. Okay, so maybe the question may be what is an emulsion? So then we will have to answer what an emulsion is. So there is
Basic liquid.
Substance contain the oil and water base combination.
Yeah, so basically you can just mention it as it is two liquids which will not mix together.
Yes.
Okay, so that is a emulsion. Okay, so can somebody give me an example of not an example, difference between a suspension, ointment, and an emulsion? Just one difference. Quantity of one particular thing will be less. What is it?
Emulsion is a bibasic liquid, ma'am. Suspension is a solid plus liquid or something like that.
No,
Ointment
just one word. Well, no, what you told is right. But in terms of only one particular thing, you can differentiate between emulsion, suspension, and ointment. It is the content of water. Okay. Emulsions will have, ointments, paste, everything for that matter. Which one do we use as a moisturizer? We can use suspension or some form of emulsion as in moisturizer. But as an ointment, we cannot use them. So it is the amount of water content also present. Okay. So that is emulsions. Okay. So we'll go to the next question. Eugenol is contained in. Where do we use
Cloud.
Okay. What product do we see eugenol in? Something that we daily use. Where is eugenol present? Yes, that's also, it's very easy. So let us connect in that way. Let us not go in very much detail because the questions are very, very direct. So let us not think also too much. Okay, so we have answers like clove, capsicum, cardamom, coriander. And the answer is clove. Okay, so what is obtained from capsicum? Any idea? What ingredient is obtained from capsicum?
Capsaicin.
Okay, capsaicin. What is capsaicin? Capsaicin is used as a
Aromatic.
no, capsicum as aromatic. No, you'll start sneezing. Your nose will start burning.
Yes, sir.
It's basically a painkiller. So you have those patches. Right? We have those patches, pain patches that we apply. That white one with round dots.
Belladonna plaster.
Belladonna patch. So there are capsaicin patches also, and it is not intended for everybody. In severe cases of pain, it can be given, but it has a side effect of being a irritant. So unless and until it is very much required, they do not prescribe it. Okay. So if a question comes as capsaicin is obtained from, then we can call it as capsicum. Okay. Yeah. Next one. Tuberculosis is diagnosed by what test?
Mondas test.
Weiden, ELISA, Mantox, Western blot assay.
Mantox.
Okay. What is Vidal used for?
Typhoid.
Typhoid.
Okay. ELISA?
HIV.
But for AIDS.
HIV. Western blot?
AIDS.
Okay. Which is for AIDS? Which is for HIV?
ELISA.
ELISA is for
HIV.
HIV.
AIDS.
Western blot is for?
Syphilis now.
Okay. Actually, it is interchangeable. ELISA test is used for AIDS. Western blot is to particularly find out if there are HIV antigens in the body. Then Western blot assay is used. But we do not have it in market separately as Western blot assay. It is called as a principle. Okay, so how is Mantox test done? What is injected?
Tuberculin.
What is tuberculin? It is a very, very small quantity of the tuberculosis agent. Okay, so it is given. How is it? How do we get to know if the person has tuberculosis? What happens after injecting?
It's bulge, ma'am.
Sorry.
Side effect means for irritation.
No, not side effect. How do you get to know
It
that?
will bulge, ma'am. If the injected area will be bulged.
Yes. So what is it called? Okay, the technical term to it is postule. POSTULE. Okay, if there is a presence of postule after administering tuberculin, then the patient is tuberculosis positive. Okay. Okay, so Vidal, anyone is aware of how Vidal is done?
Vidal test is
Typhoid. Typhoid.
Typhoid, right? But how is it done? Is it also injected? Okay, for Vidal, it is basically the protein which is tested from your blood. So when you have typhoid, then it releases some kind of antibodies. So that is given to, that is put into test tubes which has antigen. That is the typhoid causing agents, and it is obtained and it is seen if there is any agglutination which is forming. Okay, or in simpler terms, if there is any binding of this antigen to antibody. It is more, it's quite similar to ELISA test, but just slight principle changes occurs here. Okay, so for this, Mantox test is the answer. We'll go to the next one. Sorry. The rod-shaped bacteria are called Coccus, Spirilla, Bacillus, Vibrios.
Bacillus.
Okay. How many of you tell it is Vibrios? I thought it is Vibrios.
Vibrio is comma-shaped.
Vibrios is
Comma.
shaped. Okay. But primarily, how was Vibrios categorized? Any idea?
Vibrio cholera.
Cholera, correct. That is the example. Okay, wait. The answer is Bacillus. This is how the shapes of bacteria look. So if you see here, Vibrios in your right hand corner, the purple one, it is very, very similar to bacilli. Right? It is also rod shaped, but it is wider than bacilli. So many a times we may have a doubt if it is rod shaped bacteria. But for this, the answer is bacilli. Okay, let's. Okay, it's more than an hour. Do you want me to continue for another half an hour, or can we break and continue in the next class?
You continue, ma'am.
Continue. Everybody is okay. Can you just raise your hands or put your. Yes. Okay. Continue. Fine. Okay. Okay. Fine. We'll go to the next question. The end of long bones are called. Without options, answers?
Spinal cord.
No. Long bone. Understand the question. End of long bones.
Long.
I'll give you the options. Triceps,
Epiphysis.
diaphysis, epiphysis, epithelium.
Epiphysis.
Epiphysis. Okay, not diaphysis.
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 Epiphysis, ma'am.
Okay.
Diaphysis is inner.
Inner. Yes. Okay, so the answer is epiphysis. So, 1 second. Okay, so if you have the bone like this, so these are called your epiphysis. Okay,
Okay.
this is the diaphysis. It is also called the long shaft of the bone. This is the diaphysis. And where is triceps? Triceps are there right below you. Okay. The ones which you see bulge after going into gym. So that is your triceps. And what is epithelium? We saw what is epithelium earlier. What is it lining?
Epithelium, it's plus.
Out.
Your intestines.
Tissues,
Wherever
epithelium tissues,
are present, there you
layer in the skin.
yes, that is epidermis. Layer of skin is epidermis. Please don't confuse it with epithelium. Epithelium is a lining where connective tissue is found. So usually we see it in intestines. Okay, so let's go to the next question. Which artery supplies the jaw?
Capillate.
Anything else? Okay, I'll just give you options. Maxillary, left iliac, left jugular, right iliac.
Maxillary.
Maxillary. ma'am.
Jugular, okay. Okay. Okay, so it is the maxillary artery. Jugular, where is jugular vein present?
Neck,
Neck,
neck region, ma'am.
neck region, correct. So it supplies blood from brain to our aorta. Okay, so that is jugular artery. We have left and right. We have jugular vein in the form of jugular vein. Okay, tell me what is iliac artery present?
ಯಾರ್ಕಾದ್ರು ಇದು ಏನ್ ಮತ್ತೆ ತೊಗೈಲ್ಲ ನಾ ಗಾಳಿ ಕೊಡ್ತಿದ್ದೆ
Iliac artery.
ಅವನ್ನ ಕೇಳ್ಬೇಕು.
Okay, so iliac artery is present in your extremities, especially near the pelvis region. It provides blood to your other reproductive organs. Okay, so the answer is maxillary artery. Maxillary artery is your jaw.
ఫ్యాన్ ఆపండి ఫైర్ కొంచెం పొడి ముక్కండి.
I think there's a slide. Yeah, someone. You can please mute for the benefit of others. Okay, so we'll move to the next question. What is the sweetening agent commonly used in chewable tablet? Okay, I hear a child sound. Can you please mute whoever it is? Okay, options are mannitol, starch, cyclamate sodium, sucralose.
Sucralose.
Okay. Please see the spelling rightly.
Mannitol.
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 Mannitol or sucralose?
Mannitol.
Okay, so what is sucralose then?
The sweetening agent.
Then you can tell sucralose as the answer, no? Why mannitol? Okay, mannitol is a right answer. I purposely kept sucralose because sucralose is also used in chewable tablets, in non-sweet chewable tablets. Okay, so it is a synthetic sugar which does not spike your glucose levels. So that's why it is sucralose, but it is not actually a sweetening agent. Mannitol is a sweetening agent. So the answer is mannitol. Sorry. Okay, next question. A hypotonic solution can be made isotonic by. What is hypotonic solution, first of all? Or isotonic for that matter. Okay, I'll just give an example. You have alcohol, you have water, 50% alcohol, 50% water. Solubilized is called an isotonic solution. Okay. Hypotonic is probably 40% alcohol and 60% water. That means the content of alcohol is lesser. Hypertonic is when you have 70% alcohol, 30% water. So it is based on the concentration.
Okay.
Okay, so the okay, where is hypotonic and isotonic solutions and all used? Very, very, very commonly used.
Sodium chloride.
Sodium chloride is okay. Just tell me where hypotonic or isotonic solutions we see. In what populations?
Electrolyte imbalance.
Blood. No, not. Blood is there with us. What something synthetic? Can you tell me? Everyone is aware of sterile water for reconstitution of antibiotics, or for example, ophthalmic drops, eye drops. All this require isotonicity. So we should have a particular, it can sometimes be hypotonic also, but not hypertonic because it will be an irritant. So any form of sterile agents, for example, parenteral injections for that matter, clear injections, eye drops, ear drops, your nasal insufflation drops, all these should be maintained rightly. It should either be hypo or isotonic. Okay, so the addition, usually addition of sodium chloride will help the isotonic as a hypotonic solution.
0.9%.
0.9%, yes, right. But it differs also depending on the particular pH that we require for the dosage form. But usually 0.9% is the right answer.
Hypotonic solution, the RBC will shrink. RBC will burst out. Hypertonic will shrink.
Yeah, that is for blood. But I am asking in terms of pharmaceutical preparations.
Less than 0.9%.
Yes.
Larger than 0.9%. Okay.
Yes, correct. Sorry. Okay, we'll go to the next question. The pathogenic organism in milk is killed by? Yes, pasteurization. So what is autoclaving, tyndallization, dry heat? Where is it used?
Sterilization.
Yes, what sterilization?
Pasteurization.
No, the answer is right, but let us also discuss the other.
Heat sterilization.
Sorry. Okay, so in tyndallization, it was an ancient technique which it is also being used right now also. So what happens? Microorganisms, even spores are also killed in tyndallization. In autoclaving, some microorganisms are not killed. It is purposely kept. Autoclaving is done in which kind of agent?
Sterilization.
Yes, but can you give me example? Why? Who do you have to autoclave? Before what should you autoclave?
Sterile preparation.
Sterile preparation, correct. But just before that? You autoclave even test tubes, your
Vessels.
Vessels, exactly. Whichever is used for pharmaceutical purpose. In a laboratory setting, we go for autoclaving. It may not kill all the organisms, but a certain amount of spores especially will be retained.
121 degrees Celsius.
I'm sorry?
121 degrees Celsius.
121 degrees Celsius usually, but sometimes if you have to grow any fungal molds and all in petri dishes, then the temperature will be accordingly done. But usually 121 degrees Celsius, yes. Okay, dry heat sterilization. What is dry heat sterilization? It is very similar to autoclaving, but any instrument that is used for dry heat sterilization?
Hot air oven.
Hot air oven, yes. Incubators. You've seen laboratory incubators. Okay, so they also use the form of dry heat sterilization. Okay, we'll go to the next question. Morphine, codeine, and thebaine is contained in gelatin, opium, kurchi, quassia.
Opium.
Opium. Okay. So again, what is opium?
Opium is often opium poppy. It is a capsule.
No, just give me generally why is opium used? Yes.
Painkillers.
Painkillers, yes, painkillers. What schedule what does it fall into?
Schedule X.
Schedule. Why schedule X? Narcotic drugs. They are narcotic drugs. They are very habit-forming drugs. You tend to keep taking the drugs. Okay, so it is called opium. Okay, next question. Amantadine is the drug used as
Antiviral.
Antiviral. Okay, and there is another very, very common indication for amantadine. Anybody? I'll just give you the options. Antiviral is the right answer. But apart from antiviral, it is very commonly used in a particular disease. Okay, so it is used in Parkinson's disease, where the patient is facing a lot of tremors. Amantadine helps in controlling it. So the tremors are called dyskinesis. Okay, dyskinesis. So in such cases, amantadine is given, usually given for Parkinson's nowadays. And as an antiviral, we do not see much.
Used as a combination with levodopa.
Yes, with levodopa, correct. Okay, we'll move to the next question. The first Indian pharmacopoeia was published in
1955.
Yes, 1955. Again, we just have to remember this. Next question. Ranitidine is
H2.
Sorry? I'll give you options. Adrenergic antagonist, H1 antagonist, H2 antagonist, alpha. Okay. H1 or H2? H2. What is H1? Why is H1 given? Okay. H1 is basically for any kind of allergic reaction. So to prevent it or to prevent the spread of it, we immediately give one H1 receptor blocker. So H1 antagonist, for example, your cetirizine and all falls into it. It is partially H2 also, but it is primarily H1. Your Allegra, phenarizine is all H1. Okay, H2 is more of ranitidine, famotidine, and some drugs which are for peptic ulcer disease. So those are H2 antagonists. Okay, beta and alpha adrenergic, where is it used? Antagonist of beta and alpha. Hypertension. Any one more condition? Hypertension with a heart disease. Beta adrenergic used. Okay. Okay, we'll go to the next question. Okay, this is a very easy one. Occucerts are?
Eye preparation.
Yes. Okay, so that's all. Nasal, oral, ocular, eye preparation. So we have the term itself, ocular, occusert. So that would be the answer. Next one. One among the following is a communicable disease. Hypertension, diabetes, cancer, filariasis.
Filariasis.
Okay, filariasis. What is filariasis in common terms?
Elephant leg.
Elephant foot. Okay, is it eradicated in India?
No.
No. Okay, so in which region of which regions do we see more of filariasis? Sorry.
Leg.
leg, correct, but which region, like which place of India do we see?
Some region. Some region.
Okay, so we usually see a lot of tribal areas, districts around tribal areas who are affected with filariasis. Okay. Okay. Next one. Blood plasma and blood serum preparations are dried by
Freeze drying.
freeze, vacuum, spray, fluidized bed.
Freeze drying.
Okay, why freeze dryer? Okay, first of all, tell me why blood plasma and blood serum should be dried. In what kind of preparations you require it? Okay, so basically to isolate DNA or RNA from blood or from serum or plasma, you will require drying prior. And in other cases, vacuum, spray and fluidized, you may not be able to get the adequate amount of DNA and RNA, especially in RNA. It is very, very difficult to get the yield. So you usually freeze dry it for it to be stable. Okay, so the answer is freeze dryer. Next one, acetyl salicylic acid is
Aspirin.
yes, aspirin, correct. Mefenamic, nalidixic, aspirin, Sulindac. Mefenamic or aspirin, which one?
Aspirin.
Okay, now tell me why acetyl salicylic acid is aspirin.
Acetylation of salicylic acid because of
No, just give me a basic answer. Because the structure is acetyl and salicylic acid, that's all. Okay, so that is all we are expected to know. We don't have to brainstorm too much. So that peripherally, if we know things, that is more than enough. Okay, so what is Sulindac actually?
Sulindac is MSA.
Okay, so it is given to treat what? Particularly one particular disease. Okay, Sulindac is for mild to moderate osteoarthritis in elderly patients. It is given. Okay. So the answer for this acetyl salicylic acid is aspirin. Okay, next question. Salbutamol is what is salbutamol? Okay, I'll give you examples. Immunosuppressant, bronchodilator, antitussive, mast cell stabilizer.
Bronchodilator.
What about mast cell stabilizer?
Sodium chromoglycate.
Can you give me? Okay, let us not go into too much chemical. Can you give me a generic name of a drug of mast cell stabilizer?
Chromogel.
No. We just saw just before some questions we saw. I told allergies. It prevents allergies.
Allegra.
Allegra, correct? What? Which drug is Allegra?
Hexafenadine.
H1 or H2?
H1.
Yes. Okay. So mast cell is something when an allergy, when you're hit with allergy, the body immediately produces mast cells in larger amount. So which can be treated with H1 antagonist. Okay. Antitussive. What is antitussive?
Antitussive is to cough.
Cough suppressant, not anti-cough. Cough suppressant. Examples? No Benadryl. No, I don't want brand names.
Diphenhydramine.
Yes. Which is less sedative?
Codeine.
Codeine. Yes. Yes. Very good.
Chlorpheniramine.
Yes, that is less sedative also. Okay. So immunosuppressant, very, very common immunosuppressant.
Suppressant. Methotrexate.
That is not common. I asked you common immunosuppressant. What about corticosteroids? Prednisone?
Prednisolone, yes.
Yes. Okay, so see, in such cases, no, don't go for answers like methotrexate because it may not be exactly an immunosuppressant. Okay, so let us limit to something very, very common. Okay, so it can be infliximab. So there are some
Tacrolimus.
yes.
Tacrolimus.
Yes. Tacrolimus. What is tacrolimus? Which class of drug is tacrolimus? Any idea?
Macrolide antibiotic. Macrolide antibiotic.
No, it is calcineurin inhibitor.
Yes, it also a macrolide antibiotic.
Yeah, it is, but it is preferred as calcineurin inhibitor.
Yes, ma'am.
It is only used in what kind of antibiotics? I mean, what kind of antibacterial disease?
Skin
Tacrolimus.
transplantation.
Okay, but nowadays, so it's very effective in treating antibiotic resistance in MRSA. You've heard of MRSA? Methicillin resistant Staph aureus. Yeah. So it is very, very common in treating patients who are resistant to most of the antibiotics. Tacrolimus. Okay. Okay, we'll go to the next question. We have like 6 more questions. We'll finish it off. A biguanide derivative, which is used as an anti-malarial drug. Guanethidine, primaquine, pyrimethamine, proguanil.
Proguanil.
Okay, any other answers?
Primaquine.
Okay.
Primaquine is an 8-aminoquinolone derivative.
Yes. So we are looking for biguanide.
Biguanide is proguanil.
Sorry. Yes, so the answer is proguanil. Here we may have to learn about structures of few drugs, but because it's very difficult, what I'd really suggest is when you have a drug name which is very similar to the question asked. So, for example, it is biguanide, guanide. Okay, so that is synonymous to guanil. Usually, it is not. It does not come in the first when the name is there. Okay, in the later part of the name, guanil or quinolone is added. So you can take that as a tip to answer this. In this case, it is proguanil, whereas all the other drugs are used as anti-malarials also. Okay, biguanide is also an indication of for which other drug?
Metformin, fenformin.
Okay, fenformin, is it still used?
No, lactic acidosis it produces.
Lactic acidosis. Metformin, what does it produce? Louder, please.
No
Okay.
idea.
It has vitamin B12 deficiencies and gastritis as a major side effect. Okay. Okay, let's go to the next one. The pH of a pharmaceutical buffer system can be calculated by
Henderson-Hasselbalch equation.
Okay, we'll also wait for others. pH partition theory, Noyes-Whitney law, and Michaelis-Menten equation. Yeah. Okay, so the answer is Henderson-Hasselbalch equation. Just briefly tell me what is Noyes-Whitney law or pH partition. Why is it used?
Noyes-Whitney equation for dissolution studies.
Dissolution studies, okay, but with respect to one particular term you have to use. Dissolution studies with respect to solubility.
Yes, ma'am.
Okay, Michaelis-Menten equation. So we've all learnt it in physics in school. Velocity.
Yes, ma'am.
Okay, pH partition theory. Sorry. Okay, so this is it is basically to understand the barrier, the lipid barrier, or what accumulation occurs based on pH of acid and bases. Okay, so partition meaning there is a breakage there. Okay, so in terms of pH, what breakage occurs in between acids and bases is what? pH partition theory. It also has a quite a complex equation. So I'll just give you equations of this later. Okay. Next one. Injections are generally sterilized by which method? Dry heat, coagulation, moist heat, and heating.
Moist heat sterilization, autoclave.
Anything else? Yes, actually, yes, it is moist heat sterilization. Not just injectables, not just injections, even test tubes or other petri dishes. It is in a laboratory setup. You either autoclave or it is moist heat sterilization. Okay. Okay. Next one. Vitamin C is also known as
Ascorbic acid.
okay. So it is present in fruit. Oranges. Okay. Any citrus fruit contains ascorbic acid. Okay. So next question. What does general anesthesia do to the central nervous system? Activator, stabilizer, depressant, stimulator.
Stimulator.
Stimulator is it? General anesthesia.
Depression.
What does it do? You can think over and tell. Stabilizer, okay. Now what happens in anesthesia? You are put to sleep.
CNS depression.
Yes, CNS depression. You need to put your system to sleep. So it is a depressant. So if you have to stimulate your central nervous system, then what do? What is given?
Caffeine.
Nicotine, caffeine.
Caffeine, okay. Injected caffeine as what? Caffeine as coffee?
Injection. Caffeine injection.
Caffeine injection. Okay, tell me something very more common which is used in emergency use.
CNS.
Adrenaline.
Yes, correct. Adrenaline. So it is a stimulator.
Yes,
okay. Okay. We'll go to the last question. It's a simple one. Juxtaglomerular apparatus is found in
Kidney.
Okay. So kidney. So we have completed 50 questions for today. I think from next class we'll go a little more faster. And how do you want the questions to be more complex, or this questions for another 2-3 days is okay? So you give me comments, or do you want mixed questions or chapter wise questions? How do you want it? You can provide feedback.
Mixer question.
Mixed question, okay.
More complex.
More complex, okay, fine.
You need to cover all the topics.
Topics, you want me to cover all the topics? Okay,
yes.
okay. I'll see how to schedule that, because this itself is taking time. So we'll see how to do that. Okay. So no, how many hours is okay for all of you? What is the time duration that is okay with all of you?
2 hours.
Yeah, I think some of you can put it in the chat box also. Those who are not have not put your audio on, you can put it in the chat box also.
Recorded classes also available too.
Recorded, no, I think this is much better. Recorded is not available. Okay, Kaushik says 1 hour. Okay.
1 hour.
2 hours.
1 hour. 2 hours. Okay. Okay.
Is there every day classes?
Yeah, every day is what we can do, because we have very, very limited time. We have like hardly 15-18 days. So you will have to tell me how we have to do this, either 2 hours or 1 hour. You want 1 hour, 2 hours is okay. Okay, you can also think about it. You can talk to sir also about this, and then you can get back.
We need recorded classes also.
Recorded classes. Okay. I'll talk to sir about it. But recorded classes right now is a little difficult. You can give this feedback to sir also. So we'll see how to formulate this, and then we can take this forward.
Okay.
We get hard copy, ma'am, or hard copy.
Yes. I will send this to, I think I'll send this to sir today, this one. And then later we'll see how we can do this. I'll also give you practice questions. Probably we'll see if we can do 5 set of practice questions. At the end of this week, let us do 1 set. A set of 100 questions let us do. And then at least 5 sets let us try to cover. We don't have specific question papers, previous question papers of Tamil Nadu. So pertaining to other papers, and some questions are from GPAT. So that's how we are trying to do this.
Like mock test, ma'am?
I'm sorry? Like?
Mock test.
Yeah,
Mock test.
mock test we'll give. Maybe this weekend we'll take 1 mock test. Is it? I think it's just a simple mock test we can do.
Okay.
And you also talk to sir and see how we can take this forward. We'll hear from him also.
Okay.
Okay, and then I think we'll do this. But for everybody, evening is better, is it? Not in the mornings?
Yes, ma'am.
Evening
Once
is best,
upon
ma'am.
days, ma'am.
Okay. Okay, fine. Fine, then we can keep it in the evening. Okay, so okay, what is the time? 9:50. Okay, we'll end the class now, but all of you please give your feedbacks to sir. We'll see how to formulate it, and from tomorrow let us see how to go forward. But tomorrow we will start with one topic, something very, very similar we will start. I mean, very, very simple we'll start. And then we can go forward. See, I don't want to go too much technical topics also, let's not get in. Because it becomes difficult for all of you to follow. So we'll take one simple session overview topic, and then we'll go for another 25 to 30 question practice questions. We'll discuss that also. Okay, so for tomorrow, let us plan that way. 1 hour or 2 hour, you have to decide it. You can please talk to sir, and then we'll decide upon it.
2 hours is need, ma'am.
Okay,
Because we have to discuss more now.
Yeah. Okay, if it is comfortable with everybody, it is fine. So let us see.
Sure.
Okay, so all of you have a word with sir, and then we'll see how we can connect.
Okay.
Okay, yeah, okay.
Okay.
Thank you so much. Thank you.
Thank you, ma'am.
Thank
Thank
you.
you, ma'am.
Yeah, yeah.
Thank you.
Thank you. Good night, everyone.